Most people think that using a Mounjaro pen is foolproof, but the FDA's own database says otherwise. Incorrect dose administration is the #1 reported problem. I've seen thousands of patients lose so much money and months of progress over making simple mistakes that nobody explained. These aren't complicated medical errors either. They're easy, everyday slip-ups. Storing your pen wrong, pulling out too soon, missing the second click. Today, I'll show you the 7 mistakes that almost everybody makes, and at the end, I'll demonstrate the exact injection sequence that just prevents it entirely. If you're new to my channel, hi, I'm Dr. Jones DC, and I lead the coaching department at our medical practice where we've helped thousands of patients optimize their GLP-1 medications. And by the way, mistake number 4 even trips up healthcare professionals. So let's start with mistake number 1. That's literally stealing your medication without you even knowing it. Remove the pin before the injection is complete. Sarah, that nurse that I mentioned, she was removing the pin immediately after the first click, thinking that she was done. For 3 months, she was stuck at 10 milligrams of tirzepatide with terrible side effects, nausea, brain fog, always feeling cold. Studies show that auto-injector errors happen even among healthcare professionals without proper training. Here's what's happening. Manufacturer instructions specify waiting for completion indicators. The medication is thick, like honey through a straw. Pull out early and you're leaving expensive medication in the pen. For Mounjaro specifically, you need both clicks. FDA adverse event data from nearly 40,000 reports confirms incorrect dose administered as the top reported problem with tirzepatide. Think about it. Each incomplete injection could waste $50 to $100 of medication. The fix is crystal clear. Press the button, hear the first click, then wait for both completion indicators, the second click and seeing the gray plunger through the window. Your pen's instructions are specific about this, but I know you didn't read it, so it's okay, I'm here to help. Both signals are essential. But if that shocked you, wait until you hear what happens when people think that they can prep their pen ahead of time. This mistake is painful because once it happens, your entire dose is gone. Finito forever. That gray base cap, it's not just a cover, it's an activation safety. Last week, a patient pulled it off to get ready, her doorbell rang, and 30 seconds later, she came back to find her entire dose had auto-fired into the air. A week's supply was gone. But here's what most people miss. Mounjaro's auto-injector, it's spring-loaded and ready to fire at the moment that the cap comes off. This isn't like insulin pens where you could just prep ahead. That's a fatal error. The sequence is critical. First, pull off that gray base cap. This exposes the needle, so be careful. Now, immediately place that pin against your skin and twist the lock to the unlocked position. Finally, press the button and hold for 10 seconds. Get this order wrong and you risk needle injury or wasting the dose. The key is minimal time between cap removal and injection. That exposed needle is a safety hazard. Now, speaking of expensive mistakes that look completely innocent, by the way, if you're realizing that you could be wasting an entire dose that easily makes your stomach drop, then hit that subscribe button right now because we put out 2 videos per week revealing GLP-1 medication optimization secrets that can save you thousands. In this next storage mistake, it could destroy your entire month's supply. Robert, a 55-year-old who exercises 5 times a week, had incredible results his first month. Clinical trials show that patients typically lose about 8 pounds at this stage. Then month number 4, complete stall at 10 milligrams a week. It made 0 sense until we discovered his storage mistake. He was storing his Mounjaro at room temperature for weeks, thinking it was fine. But here's what matters. Every GLP-1 medication has different storage requirements. Don't assume that they're all the same. Always check your specific pen's prescribing information. The universal rules that apply to all GLP-1 pens. Store them in the refrigerator. Never freeze. Protect from heat above 86 degrees Fahrenheit. Multiple pharmaceutical studies confirm that temperature variations will degrade these medications. Even one afternoon in a hot car can potentially compromise the effectiveness. This is expensive. Ain't nobody got time for that. So I've watched patients inject potentially compromised medications for weeks, wondering why they're plateaued. The medication looks perfect, but they've lost potency. Freezing damage is invisible. If your pen freezes, even when it's thawed perfectly, it must be discarded. When in doubt, just throw that crap out. Better to waste one pen than inject ineffective medication for a month. And always verify your specific pen's storage requirements with your pharmacist. But here's where even healthcare professionals can get confused. This mistake seems minor, but affects every single injection that you do. Most people inject at random angles, sometimes straight, sometimes sometimes tilted like they're writing with a pen, but here's what matters. Consistency in being perpendicular 90 degrees, right? This is your skin, this is 90 degrees, to your skin surface for reliable subcutaneous delivery. That means into the fat. Clinical studies confirm something fascinating. The abdomen, the thigh, and the arm sites, they're completely bioequivalent. They work exactly the same, meaning you're going to absorb the same regardless of which area you inject. Collectively, that's what the research shows. Now remember, individual variability does exist, and so you got to try different areas because you might find one for you that might be better. But the angle matters because when you inject at 90 degrees straight up from your skin, you ensure that your medication goes into the fat tissue and not the muscle tissue. This is a big deal. Muscle tissue right here absorbs differently, potentially causing unpredictable results. The solution, 90 degrees every single time. Consistent technique equals consistent results. Now let me show you the mistake that makes people think that their pin is broken. Mistake number 5. Yesterday we had a patient that called panicking that her pin wouldn't fire. She'd been trying for 5 minutes, getting increasingly frustrated. And the problem? She was turning the lock ring halfway, like opening a child-proof bottle. You need a complete turn until it clicks into the unlocked position. Half turning achieves nothing. The pin literally cannot fire when partially unlocked. Studies show that these safety mechanisms prevent accidental activation, but only when used correctly. Seems simple, but I see people get hiccuped all the time. Another error, not following the proper sequence. The correct order prevents mishaps. First, remove that gray cap, then immediately place the clear end against the skin. Then twist to unlock the ring. Finally, press and hold the button for 10 seconds. But the damage I'm about to show you can actually be permanent. Amanda was obsessed with injection sites, but still destroying her tissue. She had her favorite spot, never hurt, always easy, used it every single week. But what she didn't realize, systematic reviews prove incorrect site rotation increase lipohypertrophy. This is a medical term for a condition where you develop scar tissue and they lump up by nearly 9 times. Studies demonstrate that these lumps can significantly reduce medication absorption. You're literally creating dead zones where your expensive medication can't work. The research is overwhelming. Patients with lipohypertrophy have nearly 7 times higher the risk of unexplained blood sugar problems. Proper site rotation actually improves the glycemic control. It makes the medication work better. And here's what works. Divide your belly into zones, rotate through your thighs, use your arms, never hit the same spot within 4 weeks. Here's what blows people's minds. Multiple pharmaceutical trials, including recent studies, confirm the abdomen, the thigh, and the upper arm, they're going to absorb about the same. The science is crystal clear. These sites work exactly the same. No magic spots exist. Speaking of things that seem harmless but aren't, mistake number 7, never throw your used pin in the regular trash. That needle is a biohazard. The CDC, Center of Disease Control, classifies this as an unsafe injection practice. That's why it's crucial to toss your deployed pins in a sharps container like this one. Someone could get jabbed. Disease transmission is a real thing, so don't ignore this step. But here's what nobody discusses. While not all manufacturers address this specifically, being cautious with dropped pins is important. The glass components could be compromised internally, even if everything looks perfect. You won't see those little micro cracks on your pin. Yesterday, a patient brought in a pin worth her entire month's budget. She dropped on tile, hard floor at her house, and when medication costs this much, many providers recommend playing it safe. All right, so you've seen 7 mistakes. Now let me demonstrate the perfect technique. Okay, so you made it this far. I got a question for you. Which of these 7 mistakes shocked you the most? Drop it in the comments. I read every single one, and I'm curious to see if it's the same one that gets most of our patients. Okay, now for the correct technique demonstration. The game changer technique that we teach every patient: grab your Mounjaro pen, alcohol swabs, cotton balls, sharps container. Unlike Ozempic, the needle's built right in. First, wash your hands thoroughly. The CDC confirms most injection site infections come from poor hand hygiene. Inspect your medication through the window. Should be clear to slightly yellow, like light apple juice. Cloudiness or particles, don't use it. Choose your site. FDA approved options: belly, 2 fingers from the belly button, front and outer thigh, or back of the upper arm. Clinical trials confirm that these areas work best. Identically though, so remember, we talked about that earlier. Pick what's comfortable to you, but rotate often. Clean with alcohol, circular motion, let it air dry completely, don't blow on it. Now the critical sequence, and this is where people mess up. Step number 1, remove the gray cap. Step number 2, place the clear base flat against your cleaned skin. Step number 3, turn the lock ring completely until it clicks. Keep the pin perpendicular against your skin and press firmly. Step number 4, press and hold the purple button for 10 seconds to allow the dose to fully deploy. First click means it started, but you're not done. Wait for that second click that indicates that your pin has fully deployed. Step number 5, second click plus the gray plunger visible through the window. Step number 6, and only after both indicators, you remove the pin. Any bleeding, press cotton balls gently and throw your entire pin into the sharps container. And that's it. Perfect injection every time. Hands down, the most important technique that you'll master. For those of you already on Mounjaro, what's your biggest optimization challenge beyond the injection? Because proper technique is just one piece and it's easy to master. Comment below with your specific challenges because I like to see what you guys are going through. Look, you just learned 7 mistakes that could be sabotaging your results, but watching this video isn't enough if you're serious about optimization. Remember Robert, after correcting his technique and optimizing his entire protocol, he went from struggling at higher doses to maintaining control at lower doses. His exact words, I'm in control now, not dependent on high doses. The research backs everything that I've shown, systematic reviews on site rotation, clinical evidence on completion indicators, pharmaceutical studies on temperature stability. This isn't opinion, it's evidence-based technique. If you want that level of optimization, finding your minimum effective dose for maximum results, book a discovery call with our practice. We'll review your protocol, identify what's holding you back, and create a personalized plan. I'll drop a link in the description. Don't be like Sarah, suffering for months with the wrong technique. Get some professional guidance, book that call now, and let's get you the results that you deserve. Now, if you're new to this whole GLP-1 journey and you want a comprehensive video that breaks down the 10 most common mistakes that people make on their GLP-1s, check out that video right there, and we'll see you guys in the next one.